Chronic obstructive pulmonary disease, COPD, and bronchitis are closely related respiratory conditions, but they differ significantly in their characteristics and impact on health. COPD is a progressive disease that restricts airflow due to inflammation and damage in the lungs, leading to symptoms such as a persistent cough, shortness of breath, and chest tightness. Acute bronchitis, on the other hand, is typically caused by viral infections and manifests with a cough that can produce mucus, fatigue, and a slight fever. Treatment for COPD involves a combination of lifestyle changes, medications, pulmonary rehabilitation, and in some cases, oxygen therapy, whereas acute bronchitis usually resolves on its own, but sometimes treatment may include antiviral drugs, antibiotics, and cough medicine. Risk factors for developing COPD include long-term cigarette smoking, exposure to air pollutants, and a history of respiratory infections, whereas bronchitis is primarily triggered by the same viruses that cause colds and the flu. Here are detailed aspects of COPD versus bronchitis, examining the nuances that distinguish these respiratory conditions. Affected organs, lungs, alveoli versus bronchi. Chronic obstructive pulmonary disease, COPD, and bronchitis affect the respiratory system but target different structures. COPD is a broad term encompassing progressive lung diseases like emphysema and chronic bronchitis. It primarily damages the alveoli, tiny air sacs in the lungs, leading to decreased oxygen uptake. Patients experience difficulty breathing, wheezing, and chronic cough. In contrast, bronchitis specifically inflames the bronchi, the large passages that carry air to the lungs, often as an acute response to infection or chronic irritation. Symptoms include coughing up mucus and a feeling of tightness in the chest. While COPD is irreversible and managed through lifestyle changes and medication, acute bronchitis typically resolves with time and supportive care. Inflammation location, deep lung tissue versus upper airway. Chronic obstructive pulmonary disease, COPD, and bronchitis both affect the respiratory system, but they differ in inflammation location and disease progression. In COPD, the inflammation is entrenched deep within the lung tissues, affecting the alveoli and bronchioles, leading to irreversible airflow obstruction and damage. This condition is typically progressive and exacerbated by chronic exposure to irritants, especially smoking. On the other hand, bronchitis specifically targets the upper airway, with inflammation confined to the bronchial tubes. It can be acute, often caused by infections, or chronic, where repeated irritation and inflammation can lead to persistent cough and mucus production. Identifying the location and nature of inflammation is crucial for effective management and treatment of these respiratory conditions. Common symptoms: high fever and chills versus cough and mucus. Chronic obstructive pulmonary disease, COPD, and bronchitis share cough and mucus production as common symptoms due to inflammation in the lungs, but their clinical presentations diverge with time and underlying pathology. COPD is a chronic condition often related to smoking and can encompass emphysema, while bronchitis can be acute or chronic, with acute cases often triggered by infections leading to high fever and chills. Chronic bronchitis is a form of COPD, characterized by a productive cough lasting at least 3 months over 2 consecutive years. In contrast, COPD's progression typically leads to a persistent decrease in lung function, with shortness of breath being a key distinguishing symptom. Disease duration, long-term versus short-term. Chronic obstructive pulmonary disease, COPD, and bronchitis both affect the respiratory system, but they differ significantly in their disease duration and progression. COPD is a long-term, progressive disease that is not fully reversible and encompasses conditions like emphysema and chronic bronchitis. It leads to a gradual loss of lung function over time, primarily due to long-standing exposure to harmful particles or gases, most commonly from cigarette smoke. On the other hand, acute bronchitis is short-term inflammation of the bronchial tubes, usually due to infections. Acute bronchitis often resolves within a few weeks, whereas COPD requires ongoing management and can lead to a steady decline in respiratory function. Understanding these differences is crucial for proper diagnosis, treatment, and patient education. Typical causes: bacterial or viral infection versus viral infection or smoking. Chronic obstructive pulmonary disease, COPD, often arises from long term exposure to lung irritants that damage the airways and the lung tissue, often related to smoking, environmental pollutants, or occupational hazards. The development of COPD is gradual, leading to a permanent obstruction of airflow. On the other hand, acute bronchitis is typically caused by a viral infection, though it can sometimes be bacterial, characterized by inflammation of the bronchial tubes. Symptoms include coughing and mucus production. While smoking can contribute to smoker's bronchitis, acute bronchitis, unlike COPD, is often temporary, with lung function expected to return to normal after recovery from the infection.